We're going to talk about vascular diseases, and as I said just now, vascular diseases are diseases of the arteries and veins, and normally you don't think very much about arteries and veins. We think of organs that we have, the heart, the lungs, stomach, or whatever. So we'll focus on this, and you will see some similarities, okay, between this and your organ system. So briefly, let's go through again what TeraHertz is all about. TeraHertz lies between the microwave and the infrared regions of the electromagnetic spectrum. So it is an infrared ray. You know infrared, right? You go to a campfire, what you feel? If early morning, there's, before the full blast of the sun comes, you face the sun, mostly you get infrared. That is technically near infrared, closer. TeraHertz, far infrared. So TeraHertz is mainly used in telecommunication. How many of you have 5G? Don't have? 4G phones use radio waves. 5G phone use microwaves. 6G phone use terahertz waves. To give you context. So it's mostly used in telecommunication where they exceed microwave and ideal for detect. So it can detect a lot of things which microwave and other radio waves detect. So that's why it's used in security conditions. And the other thing is almost everything has a fingerprint in the terahertz. That's why it can affect our body, because our body also give out terahertz waves. If you practice Qigong, you know what, right? You put your hands next opposite one another, you can feel the energy. And all of us give out terahertz waves. Some more, some less, but in minute amounts. So radio waves are here, microwave, terahertz, infrared. This side is very dangerous. These are the waves that can give you mutation, give you illness, sickness, right? So the breakthrough with terahertz waves came in the 1990s because it can penetrate. And so they were, old paintings, for lack of enough painting material, they paint over. So they look at a painting that was painted in the 18th century, and they were able to discover the artist's name and whatever other details of the painting. So it was published. Then if it's a radio wave, how come we never study them? We don't study them because we don't know how to study them. It's called the TeraHertz gap. This gap is because on this side we use electronics to study them. On this side, because of visible light, we use photonics to study them. Like visible light needs to study such light. TeraHertz is in the middle. Is it part of photonics and electronics? Nowadays, how do we study TeraHertz? Anybody know? Either this or this. What do you think? They use photonics. China is in the forefront of research on TeraHertz. Of course, all over the world, even the universities in Singapore have published papers, okay? But China is especially advanced. And if you are keeping up with the sciences, you know that the microchip war, right, between the US and China, and the silicon chip is getting smaller and smaller, 1 nanomole, 1 molecule thick. How China has gone into terahertz and beyond. They are looking into photonic chips, not electronic chip, photonic chip. And this is where terahertz comes. So this is the technology of the future, not the present. So telecommunications, 6G, military applications and all that, agriculture. Interesting. They use terahertz to monitor the water content of plants. When they look at a plant, they can tell when a drought, the water content goes down. That means that they can take measures. Of course, this is done only in China. China is very advanced. In health and science, because it can penetrate, so we also study this. And because human cell called the light of light, so penetrates. In fact, infrared also penetrates. And have you all gone to a infrared sauna? Not the traditional sauna, but infrared sauna, where they give you infrared. You feel good after that because it penetrates. It open up tissues, all your waste products that go because you sweat or whatever. And that is because of the heat. But if you take away the heat, what happens? If it's the heat, then any infrared will do. Even near infrared, the infrared we know will also work. But it's more than that. It's a vibration, it's a frequency, and the frequency itself is able to heal. And experiments can be done where you just remove the heat and the frequency. You still find these healing effects because it is the frequency that heals, and it's the frequency at which our cell vibrates. So it's used in medical science in these two areas. Diagnostic, you can see, it's like doing an X-ray, but X-ray can cause you harm. This won't, and the resolution is even better than X-ray. You can make up the layers in your bone, in any tissue, so it can actually see the shape and whatever of a tumor in your body. And And that's the beauty of this. But we're not talking about this. I will focus mainly for its use in therapy, how it has helped people. So the properties, non-ionizing, not like X-rays, so it's safe. Penetrate through all non-conducting material, so wood, plastic, clothing, everything it can go through. It is absorbed by conductors, so water it will absorb. It's absorbed differently by various biological tissues, and the reason is because different tissues have different concentration, and the energy corresponds to hydrogen bonds and van der Waals force. In physical chemistry, you know that sodium and chloride combined together give you common salt, right? The bonds are very strong. Common salt is very different from sodium and very different from chlorine. When they bind together, properties change. But the energy of TeraHertz is like hydrogen bonds and van der Waals. Now, a lot of you drink the TeraHertz water. Why is TeraHertz water better than ordinary tap water? It's because those forces are broken. See, water molecules are held together by all these very minute forces. So that's why when you pour water out of a glass, you put it up, there's some more water there. It gets stuck together because these forces hold the molecules called the surface tension. So when you have TeraHertz to break up these bonds, this hydrogen bond, water slide over it. They don't connect. And when they do so, then they can penetrate into cells much easier. And that's why alkaline water is good in that respect. TeraHertz also can change the shape of molecules. And that is one of the earliest things that TeraHertz can affect. And that's why there's a lot of concern about the safety of TeraHertz. And because it's going to be used in 6G phones, telecommunication, papers have been coming out to say that TeraHertz, the frequency that they're going to use, are safe for us. Because you remember there was a scare, right? You use a handphone, you can get brain cancer. So normal human cells resonate at TeraHertz at that frequency, so the activity of the human cell is activated, and we'll come to this. And so because of that, biological systems are affected and change their interactions with one another, neurotransmitters and neurons. So let's focus on what are the effects of TeraHertz on human body. Namely these few: open up blood vessels, vibrating water molecules, cell, change the small organs in the cell, and inflammatory cells get normalized, and it unzip DNA. I will go through them one by one. So the first thing you do is to open up blood vessels. Today we're going to talk about blood vessels, so this is very relevant. When it comes from the heart, it's under pressure because the heart pump, all the blood pumps here are under pressure. So water, all the nutrients that you eat go to the heart and get pumped up. Oxygen all come up, go into your tissues, your cells, muscles and all that. They use up all the water, all the oxygen, all the nutrients, and then as it passes to this side, this is a low pressure since there's no pressure. And the waste products, the water get taken up, the carbon dioxide get taken up. And so because this is not under pressure, not all the water flow in, so you need drainage. And so these are lymph vessels. This drain the excess water, the excess waste product to return it. That's what lymph vessel their function is. So irregular inflammation in the blood, besides the red blood cells, are all these cells. These are white blood cells. White blood cells are inflammatory cells. They react to any attack, any foreign body, any infection by coming out in force to kill. Like COVID-19, you got the virus. So all these cells will come out to neutralize them, whatever it may be. So it can regulate inflammation in the system, and it activates normal cells. So in a normal cell, there are small organelles like this called mitochondria, and this mitochondria have different functions, from producing energy. Your energy cycle is here. Your glucose come in, it go through this cycle, and then it produce something called it ATP. ATP is your energy molecule. And then it can synthesize all kinds of cofactors. It can metabolize amino acids with lipids and everything. And gene expression and translation, that means the gene is like a recipe. Make this protein, make muscle molecule, myosin, whatever. And this mitochondria will put all the amino acids together to make, and so forth. So when you don't need the protein, they are removed, they're excreted. So it's a very active thing. If your mitochondria is not active, you fall asleep, no energy. So this is quite critical. So when our cell or any part of our body structure is no longer needed, or a cell is about 120 days, after that space, they are removed. They are cut, divided, and these protein fragments release signals: find me, eat me. They're gobbled up by big cells such as called the phagocytes, which engulf them, remove them, digest them. So there's a new you every 3 months because all the cells in the body have been totally changed. Okay? So that's what it does. Press the wrong button. I think this. So the other thing is it can kill viruses, bacteria, fungus, all kinds of things. And that's how I got interested, because during COVID, there were reports that people were using this to treat COVID patients blowing in the lungs. In Singapore, a lot of us have to face the heat and sweat a lot, and we get fungus. So I sweat a lot. A lot of people, I got fungus. Very active. Once I was sick, I didn't blow, and then it came back. I started blowing within 2-3 sessions, all disappeared. So that's how effective sterilize. Activate DNA. You know, DNA is like a zip like that. Strands. When they're in a zip, it is inactive. When you unzip, under 2 conditions you want to unzip. One, you want to duplicate. In other words, you want to make another chromosome. So you must divide. So you must duplicate another set. So you open up so that you can duplicate another. Another one is when you want to read the recipe to make a protein or any glucose compound or whatever. So you have this RNA printer. They read the thing and pass the recipe to the RNA, which then go and make it. It's a very unique process, you know. They don't have ABC, but they have specific protein molecule that is something like the alphabet. Just 4 of them. Just 4 of them with 4 letters, A, B, C, D. You can create all the proteins. So quite amazing, isn't it, nature? So that's what it does. So now when you see what the effect of TeraHertz is, you can begin to understand the effect on vascular disease. Vascular diseases are diseases that affect your circulatory system, which consists of all the blood vessels. So in a sense, it's like the water supply. On the positive side, coming out from the heart is like water supply, everything that you need. And then there's a drainage, the venous system. Drainage is like the sewerage system, take away all the waste products. So they include arteries, veins, and so diseases cause vessels to narrow, swell, get hardened, blood clots, and block. And when everything gets blocked, things you don't get your supply of nutrients, oxygen, waste products get accumulated, can't get rid of. That's what happens. So these are the diseases we'll talk about. Peripheral vascular disease, sometimes called peripheral artery disease. It simply means that this disease is of arteries, right? Venous insufficiency, then there's varicose veins, all ladies, relevant because this affects you all. Deep vein thrombosis, aneurysms, there's nothing we can do about it in a way, but some of the risk factors, yes, we can do something about it. Worth knowing. Pulmonary embolism, there's nothing much I can say because no symptom when you get it, you need emergency help. You need to rush to hospital or else. So you can see that the conditions are quite interesting, and it helps you to understand that they are quite an essential part of our function, although we don't think of them as an organ. So in peripheral artery or vascular disease, there is less circulation to a part other than the heart or the brain. In the brain, when there's reduced circulation, you get what is known as a stroke, right? In the heart, you get a heart attack. So it's other than that, outside of the big organ. So usually caused by atherosclerosis. This is the thickening of the artery that causes your heart attack or your stroke. So when the artery gets thickened, narrowed by atherosclerosis, and you get a stroke or you get a heart attack, what if it happened elsewhere? It's also similar, isn't it? The process. So fatty deposits, plaques reduce the flow, is something called intermittent claudication. You would have seen this. Some people walk very painful, they rest. Usually after about 25 to or 20 to 30 minutes of walking, they feel painful, then they rest and they feel better, they walk again. Then pain again and walk. So intermittent claudication pain. So usually it happens in the leg. It can happen anywhere, of course, but most often occur in the leg because for the artery to go down, it's easy to come back, difficult to go against gravity. So when the narrow arteries of the leg cause reduced blood flow, you don't get enough oxygen, you don't get enough nutrients, it happens, get ulcers, and cells can die. When they die, you see black. I'm sure you've seen it if you have diabetic relatives, and of course you need amputate. So if you have this, it's a good indication that you will have a heart attack or a stroke because the disease process is similar. When you feel the pain and you relieve by rest, then you're telling you take care of yourself, a heart attack. So what are the risk factors? Age, smoking, high blood pressure. You see the usual suspect always here: smoking, high blood pressure, high cholesterol, diabetes, poor diet, obesity, lack of exercise. In my chat group of old boys saying how to live long, talk, mix with friends, talk nonsense. Does that work? Play mahjong. Does that work? The most effective way to live long, what do you want? Exercise is exercise. Once you exercise, you're going to eat well. And once you eat well, and once you exercise, then all these things will start to go down. Very simple. Some people are very proud of the fact that they have a little flap here. That means your muscle have gone, have disappeared. I don't have, because I am toned up. So these are the risk factors, and it always happens in the legs, as I say. This is a narrowing, and when you get blocked, that's what the danger is. Normal blood flow, when it's blocked, reduce blood flow. See, when you turn black, it's like that. Really horrible, isn't it? But you see this in diabetics. If you have a family history of diabetes, you will see very common. A lot of diabetics, they have a good food, and towards the end of their life, they have all these things and they need amputation. My friend, the mother, both feet, and this is not the only one. There are a lot. So as I say, intermittent claudication, muscle pain, cramp, the legs feel cold. You put your hands, feel cold, numbness, reddish blue color, discoloration. Other than that, it can be asymptomatic. Or when you're walking, then there's symptom. So how do you deal with it? Like the heart, if we can, we do an angioplasty, put a stent inside, use blood thinners, and any underlying hypertension, obesity, diabetes must treat. There are many things you can do to help yourself. Keep your heart healthy, low-fat diet, pay attention to sores, cracked skin, numbness, avoid the cold, dress warmly, sleep with legs elevated so you can return to the heart easier.
Elevated head.
Elevated head, yeah, also.
So like,
elevated feet also. If you elevate, then you leave your feet. L-theanine and mesoglycans are supposed to be helpful. Mesoglycans is carbohydrate, something like your collagen. TeraHertz improves symptoms because it removes waste, opening up the blood. A lot of waste due to. So how do you treat? This is a bypass of the artery. This is a stand in. Common symptoms: leg cramps, foot pain, slow to heal. So usually all these things are diabetes out there. Exercise, work at least 3 times. Don't exercise every day. You know why?
give the body.
Yes, leave the body to recover. If you exercise every day, we have a friend who exercises every day and she ends up with very bad arthritis and has to go for knee replacement because as you go older. So among my medical check group, walk. Long life is associated with long walks.
So every day walking is okay.
Walk
20 to 30
about
minutes.
up to an hour.
That's the. Are you talking about brisk walk?
Brisk walk. Just
right?
walk.
Yeah.
Not
So
the type of walking you do in shopping malls. That's a different kind of walking. But if you want to improve your cardiovascular health, you do a combination of walk, jog. That means you do a brisk walk for maybe 2 or 3 minutes, then jog for 2 or 3 minutes, then walk for 2 or 3 minutes. Alternate. I do that now, and it has its benefits because by not jogging the whole time, you save your knee, right? But by jogging half the time, you raise your heart rate and your blood pressure, which means that you cause the reserves of your heart better, improve the cardiac reserve. So these are some common sense advice. Venous insufficiency, in other words, the veins fail. Now this normally is in the legs, where there's a pooling of the blood damaging the venous valves. All the veins have valves. Well, I don't know whether you know that. So when your blood flow up to the heart, it goes through the valve, it cannot flow back. The valve will prevent the blood from flowing down your leg again. That's why the valves are there. So when the veins are swollen, what happens is strain the walls, right? The wall gets stretched. It's called chronic venous stasis. These are all these names refer to the same. Usually affects the legs, sometimes the arm. Maybe those who work in jobs that require to carry things. Legs swollen, visible varicose veins. And nowadays people like to wear shorts. Everybody are wearing shorts. You can see it on the legs very clear. You can see the pattern. Zigzag pattern. If this is art, it will be wonderful, but it's not art. So it's a dull ache, cramps, heavy feeling. Pain is worse on standing. It improves when the legs are up. Tingling sensation.
What about those have problem with the leg? We call it podiatry's kind of problem.
Podiatry has to do with your nail.
What? Nails?
Nails and the arrangement of your legs.
So there's a plantar.
And the soft tissue there, the fascia, the soft tissue.
Oh,
yes.
so can this machine help in any way?
Yes, it does. It does. But you got to solve the problem. As you get plantar fasciitis is different order, a big topic. It has a lot of complications. Realize it as you grow older. Okay, so it will be a lecture in itself. So I can't give the lecture in the lecture.
Okay.
All right. I think I have talked about it in one of the. I can't remember. I was talking about the ankle and all that. I think something on arthritis.
Do you have a record of
Yes,
that?
I've spoken on it.
Yes.
I remember. So this is what will happen. You see varicose veins. You see darkened hard or leathery skin. You see swelling, pain evidence, restless leg syndrome, leg cramps, itchy. These are the valves. Prevent blood from flowing back. When the valves get jammed of the collection of blood, that's where you get your varicose veins. So normal. First you see spider veins. then you see varicose veins, then you see swelling and skin start to be discolored. And final stage is when you start to have ulcers because of this. So when your hair start to do something, don't wait until it's too late. These are all the various stages, right? And why is common in women when you're pregnant? There is a huge force to prevent the thing. One of the contributory factors, and then of course other things come. Over 50. Why over 50? When you're menopausal, you're no longer protected by your female. That's why. Female and positive family. Female is always a risk because children. History of blood clots. If you have a history of blood clots, obesity, pregnancy, a risk factor. So if you sit or stand for long periods, a lot of hawkers are ladies and they're very hard working. One lady I know was a very enterprising hawker and very bad. Standing, got to prepare food, got to wait whole day long. Tall height because the veins have a longer distance to travel. It's true, right? Smoking, again, lack of exercise.
So is this more applicable to females?
More applicable to?
females than
Which one?
I mean this CVI, the CVI.
Which one? Which one? No, it can also occur in male.
Okay, no,
Except pregnancy lah.
more
Yeah.
prevalent in women.
These are risks. These are risks.
Oh, risk. I see. Okay.
More
Okay.
female than male.
Okay.
It doesn't mean males won't get it. They do. We do see that.
Oh.
Before my dad passed, I recall that he had. But he used to be running a store in the fish market, although he has a business besides that. But because he need to stand the whole day, so it's a risk factor, right? So medication, again, the usual thing: aspirin, laser ablation, radio frequency, sclerotherapy. Sclerotherapy is we actually inject something to make the thing die, so it turns fibrotic. So we can ligate, we can strip the vein. In the surgical department, I did assist some surgeons to strip the varicose and remove the vein. So movement, compression stocking. Nowadays, a lot of people sell compression stocking, isn't it? It's supposed to do great wonders for you. Well, I don't know how true that is, but somebody sell it to my wife, and my wife was wearing it. So THz radiation. Why THz radiation work? Because if laser ablation, radio frequency ablation work, THz is the same. They use frequency, but it also tells you that radio frequency does work by various means. TeraHertz has the advantage cost the impression at its worst is like so. Treatment option if at least 1 hour per day, at least 6 days per week to prevent recurrence. That's how often you must wear it. Dressing, cover ulcers, antibiotics and so forth. Surgical, remove, skin grafting for ulcers. Because once you have all this circulatory problem, healing is one of the problems of dealing with veins and arteries. That's how you strip the vein with 2 cuts, and then something is inserted. Yeah, something is inserted and hook onto this one, pull the whole thing out. So after stripping of the vein, you see all these cuts.
Is it because
Huh?
due to blockage?
Yeah, very close.
So yeah.
When the veins are very close and thick and huge swollen veins everywhere, you strip them because they've been there for so long and the blood inside may well have clotted. And rather than try to relieve it, move it. Don't wait till you state. It's not a nice thing to have. But this is what happens. This is real life. We see this. Deep vein thrombosis. This is serious. This is clot forming in one or more of the deep veins in your leg. Deep vein thrombosis usually occur in your calf muscle. The calf is supposed to be your second heart, right? It's pump blood back to your heart. And clots, they form within it, and it form because the blood flow is very slow. Because the blood flow is slow, then it clot and it can also cause it to block. The most important cause, sit down for long periods, especially during air flight, flying on air, just sit in a chair, don't move, can be caused by injury. So if you have a fracture and the age of the fracture can cut the vein, cause that to have a history of clotting disorder, that is a risk factor. So the swelling, there's tenderness, leg discoloration, pain. So when it starts to happen, this deep vein thrombosis, you have shortness of breath, chest pain and racing heart. You may feel like passing out. So the most important thing about deep vein thrombosis is it can cause pulmonary embolism, which is life-threatening. That's why it is serious. Elevate your legs to improve flow. Compression, stocking, blood thinners. Exercise, but do not massage. It's very important. If you suspect it's a deep vein thrombosis because you have been sitting for too long, do not massage. When you massage, you precipitate a pulmonary embolism. You massage, if there's clot inside, your massage will release the thing and it will go. You must know this. So you're sitting on an aeroplane, what do? Do some exercise. You remove the clot somehow or something. If it is deep inside your clot. Yeah, you don't want the clot to be dislodged and go somewhere else. If you end up in your brain, you'll be a stroke. End up in your heart, you'll be heart attack. End up in your lung, you got exactly what it is here. Pulmonary embolism. So you can remove the clots by catheter laser therapy. TeraHertz does help. But this is not the main thing because this is self-help. You need medical help. You need medical treatment, and that I have to stress. So this is deep inside, this is not on the surface. So the valve can collect and then it become a blood clot. And then when the blood clot broke off, it becomes what is known as an embolism. So you see, when deep vein thrombosis occur, the leg thicker than normal. Prevent healthy weight, keep moving, regular walks, keep yourself hydrated. On an aircraft, hydrated means water, not alcohol, not coffee. Alcohol and coffee cause you dehydrate. Avoid crossing legs while sitting. That's why you go on a flight, loose clothing. Don't wear tight skirts that cause you to cross automatically. Avoid smoking. Don't consume alcohol. And these are all the causes from heart failure, cancer, stroke, injury, smoking, hormonal drugs. Hormonal drugs can cause this. Birth control pill, hormone replacement therapy. All that can cause this. Bed rest, pregnancy, injury. If you are family history, 60 years old, standing, varicose vein. So to prevent, get up and walk every 1 to 2 hours. Make sure that you move because that will cause your veins to contract. Exercise your legs while sitting. Raise your heel, toes on the floor. Then heels on the floor, raise your toes. Tightening and release your leg muscle. Loose clothing that enable you to do all these things. Stay well hydrated, avoid risk, smoking and all that. And if you have high blood pressure, clotting disorder, check with your for advice. Very important because this thing do happen and it still does happen, although many people are aware of this now. So you see on flights now, long haul flights especially, you see people walking up and down. That's good. But sometimes it interfere with other things. But it still does happen because there are risk factors. Those people at high risk still. So this is terribly important because deep vein thrombosis is something that is totally preventable. Aneurysm. Aneurysms are due to weakness of the walls. When the walls of the arteries are weak, and you know arteries come from the heart under pressure. There's pressure. So if there's a weakness in the wall, it's like a balloon, you see. When you blow, your air is under pressure, the balloon expanded. So the weakness in the wall causes the artery walls to be expanded. Since blood is from the heart under pressure, that's what happened. And the thing about aneurysm is totally without symptoms. It's not painful, it's not symptomatic until it ruptures. It's like a balloon, you blow, keep on blowing, you will rupture. The important locations are in the aorta and the brain. And we'll focus on this. It can happen anywhere. In your intestine also you can. But if these are minor, it's okay. You just feel some pain, it goes off after some. Coming out from the heart, it balloon out over here. And the abdomen is balloon. So in the veins, it can occur anywhere in the brain. There's a lot of blood vessels there. Underneath the brain, there is a blood vessel called the circle of Willis. It's called the circle of Willis because it forms a circle. But this circle of Willis, if you look carefully, a lot of the blood vessels have very sharp angles, isn't it? If you were to drive and then you go this way, sharp angle. Even if this is a road, it's going to be quite difficult for you to maneuver, let alone these are blood vessels under pressure. So you can imagine it can happen anywhere. There are prominent people that have this kind of aneurysm. One of our ministers had. I know bishop's wife of a former bishop, you might end up with a stroke because of this. So it is common enough, right? Because you can be totally asymptomatic. You don't know until it happens. So these are the places that you can occur. If it is mild, you survive. Hemorrhagic strokes, easier to survive. But you need resuscitation. You need to be nursed. Somebody who has come here who is using TeraHertz, he has a stroke 10 years ago. Survived. Although he still need a walking stick to walk, basically recovered from hemorrhagic stroke. So abdominal aorta. Abdominal aorta means the aorta behind, near the back. Aortic is chest area. In the brain, carotid aneurysm by the side of the neck, the carotid artery. This is rare. Popliteal is behind the knee. Mesenteric artery is intestine. Splenic artery is artery that supply your spleen. So all these locations are not so important. The first three are the most important. 2 to 5% of people have unruptured. 25% of which have more. 25% is 1/4, right? So 1/4 is about half to 1% of people have multiple. And what that means is possibly you have a family history. So one indicator is if anybody among your relations have this kind of problem, you're likely to have one. Now it occurs all the while from childhood all the way to adult. And it can be there all the time without you knowing. So, but the main age of detection where we detect the aneurysm 50 years, more common in males. Interestingly, brain aneurysms are more common. Female, I don't know why. It could be due to the hormonal. Aortic aneurysm more common in male. At one time, when we don't have proper treatment for syphilis is one major cause of aortic aneurysm.
Can that be,
Can
it be referred?
if you can detect it,
I mean, naturally, if it's like naturally, can it kind of heal?
yeah, if you detect it, let's say you did a body scan and they found aneurysm, yeah, you can go in. But usually I'll come to it. Some things that can be done. Smoking is a risk factor. When rupture, imagine aortic aneurysm are the worst because a lot of blood. Brain, if the artery involved is a small artery, all small little area, not so serious. So it depends on where it is. It's a loss of blood that is hospitalization and medical treatment mandatory. You really have to go to hospital. What causes aneurysm? High blood pressure and a positive family. The thing is, it's always asymptomatic until rupture. You don't know. A senior doctor retired recently. He was in a state of shock. Said to be heart attack because of chest pain. Rush to hospital, turn out to be aneurysm. And so what do? They tie the aneurysm. They tie it so that they can seal off the thing. So he was safe. So it can be picked up incidentally if you do a scan, MRI or ultrasound. So treatment, you do intravascular repair. Inside repair, block it, or you put things in the aneurysm, cause a thing to clot, seal it off, or go open heart surgery, repair. Remove the aneurysm, repair by graft it because arteries, remember, are under pressure. So you put a graft there, it's strong. So intravascular, if you go within the artery, you pack it with coils to reduce the blood. That's how it prevent. Very simple thing. Anything to do with the heart, anything to do with blood pressure, do something. Get it treated, avoid smoking, in a healthy way, exercise, and you should be somewhat protected. So that's what is recommended. Otherwise, there's nothing you can do about it until it hits you, or unless you discover it by chance. So this is quite real in the sense that aneurysm, because it is totally unknown, and unless there's a positive family history, and sometimes you don't have a family history, it can be life-threatening. And if not picked up early, and some people have this habit. I've heard too many stories of people with chest pain not going to hospital because it goes up. So no, it's not all. You must know the cause. Many conditions come. Many conditions that are minor, like muscle sprain, can also give you chest. You don't know which is which. The only way to find out if your chest pain is severe enough to hamper you from doing your own thing, find out what it is. At least make sure it's not due to the heart, because if it's due to the heart, somebody shared with me that they have chest pain at a dinner, at a function. Ignore it, it goes away. Then it came again. Fortunately, somebody who is medically trained, you better go to hospital. They don't want to live. No, you got to go. Finally, end up 2 stents. So when you have symptoms and it didn't quite go away, and it's not the usual, something unusual, please respond to the signal that your body is giving. So therefore, it is important because there are serious conditions. Heart attack and stroke we know. The common things we know, but there are a lot of uncommon things there, and uncommon things you don't know. So this senior doctor I was telling you about, he also had chest pain. This doesn't look like heart. So we did it there. That's what I heard, the gossip, no? So ultimately he was persuaded to go, and they did a full checkup here. They did for the ECG of the heart, normal, but he still was having the pain. Better do a scan. Eventually they picked the aneurysm. So unusual things sometimes happen, and this is one of the unusual, which is serious. So thoracic, you have hoarseness, chest pain, breathlessness, abdominal pain, pulsating feeling. If you feel something pulsating, serious. Thunderclap with headache, nausea, vomiting, stiff neck, blur, double vision, sensitivity to light, seizures, having a fit, loss of consciousness, pain above and behind your ear, confusion. This also is quite common. People who get confused. Again, I hear this story of somebody who was quite confused. They thought because of his age that maybe dementia is coming, but because he was acting confused, uncontrollable, they called him to hospital. Turned out to be weakness, drooping eyelid, brain aneurysm, abdominal, or a different place. Pulmonary embolism, this is probably serious. This is suddenly your pulmonary arteries, the arteries that come from the heart that go to your lung. When your pulmonary artery is blocked, and there's only one cause for the pulmonary artery to be blocked, when a clot from somewhere, a clot from anywhere and not the place where it is, called an embolus, called emboli, broke off from a vein in the legs and travel. And often not one. If one, you can deal with it. Often when, let's say, you have deep vein and you massage it, you send out not one but multiple clots all over your body. When I did my heart stent at that time, They put 3 stents. Some years later, I go for a brain scan because I feel, let's do it. Time to do a brain scan. So brain scan, they pick up small, tiny areas of micro. In other words, these places have emboli, but because they are very tiny, microscopic, so the area that is destroyed by clot is very small, maybe the size of a dot in multiple. So when a radiologist view the result, asks to see me and view my results and says, do you have anything? I say I have my stents. Oh, it probably comes from there. So when you do a stent, right, put in the balloon, blow it up, it must have dislodged some of the atheroma, okay, and tiny bits, not big, tiny bits go all over the brain. So imagine if these are huge, which in this case clot from the deep vein of your leg, slightly big, much bigger, what can happen? It's a life-threatening. And why is life-threatening? Sudden. Because your leg muscles, if you don't move them, and let's say you have varicose vein, alright? Deep vein thrombosis, like the varicose veins of your deep vein veins in the muscle. So if clots are there and suddenly you start to move, it can dislodge them, and that's why it comes suddenly. The usual symptom: loss of breath, chest pain. You can lose consciousness if blood pressure of course suddenly drop, which sometimes happens. Immediate resuscitation is something to give oxygen as well as cardiac massage, often is needed. Sudden and a loss of. So the symptoms, the most important symptom is breathlessness and chest pain. If they cough, you often can find blood, or the mucus is streaked with blood. Pain or swelling of lower legs, that confirms it. If there's swelling in the leg and there's pain, that's it. Lightheadedness, dizziness, irregular heartbeats, fever, excessive sweating, and more so there's clammy, discolored skin, so bluish purple. So these are the symptoms. Come on very suddenly, and you have not been moving, do something. The type venous thromboembolism, it can be due to fat. Okay, if you have a fracture and surrounding are some fatty tissue, some fat can dislodge. Artery embolism is from the arteries. Okay, air embolism is the other thing that sometimes happen. Usually also associated with fractures, where air bubble get introduced, and air bubbles in environment like the veins and the artery, which is all liquid, air bubbles stand up. So air bubbles can cause that's why when they set you a drip, they make sure that there are no air bubbles. Is very important because you can cause blockage. So from the legs, it go all the way up to the lungs, and when it's blocked, not a single one, but multiple ones, always more often. So what has TeraHertz got to do with vascular? Well, the point is that TeraHertz can penetrate, and because of its effect in improving circulation and improve the immune system and being easily absorbed by water, the energy gets absorbed. So the effect of TeraHertz induces a state of tranquility, alleviates stress, induces calm, it revitalizes the energy level, fosters sense of vitality. In other words, it strengthens the body, activate anticoagulant potential of clot. In other words, prevent further. That's why TeraHertz is used.
Prevent, but let's say if there is slight blockage, can that?
If it's slight blockage, you may not be aware. You must realize that, let's take the heart as the goal. Your heart must be more than 80% blocked for it to produce.
Okay, no, I mean, so let's say without prior knowledge, but there is already in there, and we use the TeraHertz, can it?
Yeah, it can.
Remove it.
It can. And there are instances where, if let's say, use the heart as a because it's the same everywhere. If your blockage is 80%, I've known of a couple of where the cardiologist say, okay, your thing is stable, it's not evolving. You don't operation, then you rest, you exercise to your limits and rest and do whatever you can to dissolve the clot. They improve. It can happen.
No, but say without knowledge of it, right? Say for instance, I've not done any check.
If you have not done any check, then you're waiting for something to happen.
No, then if I start using TeraHertz,
if whatever you do,
yeah,
you either improve it or not at all. If you don't improve it at all, then you keep on growing until you hit about 80%, and then suddenly.
Okay, maybe the way I want to ask it, you already know that you already take grad and
Okay,
you've
let's say
shown the heart
your
has a
blockage
60%
60%.
Yeah. So can that 60% be reduced?
Yes.
That's the question we want to know.
Yes.
Yeah.
Yes.
Yeah. Because if it's just to, or is
It
it
can
just
be
to, or
reduced.
just to maintain and no more?
I tell you about my experience. I work with cardiac patients many years. There are patients with 60-70% block. They were asked to do simple things known at that time to exercise, medication prescribed by doctor. They improve. Because when you start to introduce measures, okay, once you exercise, you must know exercise stimulates stem cell.
Because this is opposite of what I'm understanding. Okay, you can exercise and all that prevent it from further spending your 60%, but there's nothing you can take away that it's going to
I don't know. Maybe he doesn't have. I work with heart
That's what
patients,
I heard lah.
real
Okay.
heart attack patients. My first exposure was when I was at Stanford University. Heart patients, real heart patients, and I interviewed about 30 of them. Singapore. Work locally, Department of Cardiac Rehabilitation. I work with a lot of heart patients, and I've written a couple of papers on it.
So in other words, 60% can be dropped down to 30.
Whatever the percentage, as long as it's stable.
I know, but does it reduce? That's all.
Yes,
It does.
that's my answer
That's all
to
you
you.
know. Okay.
I keep repeating it.
Okay.
Because exercise induces stem cell activity. Stem cell heals. Right? And I said it years back in that era, when I was in Stanford, they don't have stem cells, they don't have TeraHertz, they do simple things, exercise and blood thinners. And it happened. And they can even demonstrate, they even demonstrate that where the blockage is substantial and the person don't go for operation, they regenerate new blood vessels to overcome them. So you're speaking to somebody who has knowledge of it. So the doctor may not have any awareness, see? But I work with heart patients.
So with size, right? The
Exercise.
level of activity.
Always exercise to your limit. Stop.
Okay, say like I'm on the move all the time, do exercise. I'm
No.
walking up and down, a lot of that. So
If
does
you
that count?
cannot sustain a level of activity, something will stop. Either you can't go on
No, what I mean is, like you said, exercise, right?
to your limit.
No, I mean, say I'm on the move all the time, not exercise, but
Yes.
on the
Even
move
if you're on the
considered-
move all the time,
it's considered,
also to your limit.
oh, yeah.
If you reach your limit, you're on the move and it's beyond your limit, you will stop.
Oh,
You
yeah,
will
yeah,
have
yeah,
to stop.
Yeah. No, is that sufficient exercise? Would that be sufficient?
Depends on what you mean. Okay, the activity must be able to generate at least some breathlessness or rapid pulse. There must be an exercise response, and you must also realize that exercise serves many functions. One of them is strengthening your muscles and bone, and for that, to improve muscle strength and bone strength, you need resistance, whether anaerobic or aerobic. They're two different forms of exercise. See, so you got to exercise to your limit and stop there. If you exercise to your limit, let's say your limit is here, all right. Once you're used to it, you find you can extend it. So when I first started exercising at 40 years old, about 31 years ago, I can exercise to this level. I get used to it, comfortable with it, I can extend. So that's what happened. And I say, when you start to extend, sometimes your body cannot remove or the block, you will grow new blood vessels. That have been demonstrated. It's in the papers, probably. Several papers have established that. So whatever the doctor says is contradicted by other finding. So sometimes I may be wrong also. But if somebody would come to me, or if I read in a paper that say this, okay, I will change my view, because these are scientific findings. It's very important to do that. That's why there's a lot of things we can do to help ourselves. I know one of my patients, the husband was just absolutely refused to go for heart stenting or whatever, bypass. So he worked within his limit, and as time goes by, he stented. So something is happening, but we don't have the proof. We don't have the investigation to show that more arteries have grown. See? So there's a lot we can do, and it prevents clotting, and so by preventing clotting, it all slowly opening up the vessel, and that is thoroughly important to know that. So for vascular diseases, we know that lasers have been used. You've seen the slide, right? If lasers can be used, lasers usually low light laser, which is infrared. So far infrared is better than just ordinary infrared lasers. So it can be used. And in fact, there are people beginning to look at this. That's why I can look up many papers where they showed all these things. Activity of TeraHertz are positive for vascular diseases in improving this treating. Number one, improves control. The slide beginning of this lecture. You can remove waste products, because when you open up the channels, waste products are removed. You can reduce inflammation and promote healing. So the website you saw just now, the testimonies website, you find many people with heart disease and diabetes testifying that it helped them, and that is the living evidence that TeraHertz can work. How about stem cell? Because I meant stem cells are cells that allow your body. In an earlier talk on, I believe it was I said that exercise actually damage your muscle, but because it damages your muscles, it stimulates the stem cells, and so you repair the muscles, and you can do more. You continue to exercise, you damage some more, and repair some more, because whenever there's injury, stem cells will appear. See, but if you grow old, because it's sedentary, there is no excitement, no stem cell activity seen. So our body have this mechanism whereby if there's a signal that something is wrong, you put out the stem cell. So stem cell therapy can regulate the fat level, reduce the inflammation, repair damaged tissue. In fact, if you take a healthy diet, fresh fruits. In fact, a lot of stem cell activity is stimulated by the glucans. Glucans, complex carbohydrate, include things like your glucosamine, glucose, right? Glucosamine, amine of glucose. Have this ability, you all like oats, right? Barley, right? Chinese believe in that, right? You know why they are helpful? They contain beta-glucan, very potent stimulant of them. That's why barley is good. That's why oats are, see? So these are things that we don't know in the past, but we know that they work. That's why people use them. MSC or mesenchymal stem cells. These are stem cells that people use if you go to a stem cell treatment center. Infuse you. These stem cells are donor stem cells. They harvest them from embryonic stem cells and culture them, and they're expensive, of course, stored cryogenic condition. For people with heart disease and all that, they show that you can stabilize blood cells and all that, prevent plaque rupture. In fact, the earliest paper I ever read on stem cells was around the year 2000. It was in Scientific American. They described take two organs that are very slow growing. Heart, you take the bone. Bone's supposed to be there, right? But you didn't know that your bone tissue has a very dynamic structure. That means every day bone cells are being destroyed, and every day bone cells are being formed. So normally the brain cells that are broken down and the brain cells that are being formed are such that your bone is in a steady state. And you know why you got osteoporosis? When your bone cells that are destroyed is more than the bone cells that form. So you get osteoporosis. And that is the basis of medical treatment. If I can stop the bone cells from destroyed, then the bone cells that are being formed will be enough to maintain the bone. That was the idea. It's a good idea. It worked. The only problem is long-term side. That's why a lot of people. But you can take it safely for about 3 years and then you're alright. So that because the medicine never quite leave the bone. That is the unfortunate thing in that your bones will always be good from then on. See, stem cells can repair that. Heart, we have shown the paper in 2000 I talked about have shown that even though you have a heart attack that's damaged cells, it can be repaired. My heart also was repaired because I take stem cell nutrition. Stem cell nutrition are substances, usually vegetarian, that you take, irritate your bone marrow, release stem cells. So these are not donor stem cells, these are your own body's does. So vascular diseases, atherosclerosis, all that, stem cells can contribute. So in atherosclerosis, bone marrow, stem cells, mesenchymal stem cells, adipose tissue from the fat cell, the stem cells, tissue repair, anti-inflammation, form new blood vessels. And remember I tell you about people who exercise, new blood vessels are formed. That's what angiogenesis, that's what it is. See all the different kind of stem cells. So it can activate fibroblasts, bone marrow stem cells, regulate the immune system, anti-inflammatory. How much research is being done? For me to get all this diagram means a lot of papers have been published. So I got all this thing. It tells you one thing, that scientists are actively. So is what matters, mind or matter? If your mind is good, nothing else matters. Then when your mind is positive, you will want to do some exercise. When you do exercise, you maintain good habits. Once you maintain good habits of diet and everything, you will naturally reduce your stress and you'll take steps to reduce your stress because you enjoy your life. And then when you reduce your stress, you have life, your vitality, you want to be connected with people. And then you make choices because life is so worth living. When I tell some people about cancer, no, I don't want. I'm ready to meet my maker. Okay, fine. No objection. We are ready to meet my maker. But it also tells me that they have lost purpose in life. They have done their work, life has no meaning for them. So they're prepared to, somebody asked me why would you want my children all grown up, give me I want to make because I can bless others. I've always been giving. I always give to orphans in different parts of the world, China, Laos, Spain, Myanmar, all these places. So when one boy who supporting which age was out of the program, I was informed, so I wrote a letter, be fruitful, be productive, do good. And he wrote a letter back to me. I was very warm. A few, not all will write back. A few did write. A few write the standard letter. That is the field worker. But it's a very enjoyable, see somebody grown up, whatever it is. And that's why I make, if I can make the money and help people who needs help, that makes it life worth living, and we have the technology to do it. So I want to be alive. I want to be able to bless other people. Is your mind full or are you mindful? Focus on intention. You know, you have seen a lot of films where Chinese Kung Fu master can beat the Western judo expert or whatever, right? Many times you see that you ask the Chinese martial art expert, they say we focus on intention. That's why we can break. It's an intention, not a problem. Westerners focus on process, nitty-gritty, how it's done, We Asians focus on intention. We focus on the outcome. And to me, that makes all the difference. Because process is the means to an end. We want achieve. When you focus on intention, mindful, for your health, when you're mindful, because when you're mindful, you realize how much you have rather than how much you don't have. When you focus on process, how come I don't have this? How come I don't have that? How come I have this and I don't have that? That's why he's faster. It's not a competition. You're competing with yourself. So when you're mindful, you're grateful. I'm grateful for what I have. And that to me is the way forward. In fact, now more and more Westerners are discovering it because more and more Westerners are practicing mindfulness. More and more Westerners are discovering that gratitude is everything. So there's a habit now in the self-help literature, maintain a gratitude journal. You know what's a gratitude journal? End of day, you think, what can I be grateful? So they may not believe in God, they don't thank God. Oh, I'm going to be grateful for one fight. And it makes a world of difference. Believe me, if you are religious, be thankful to whoever you believe in. It makes a difference. If you're not religious, you can still maintain a gratitude journal, and that help you achieve a difference. That's how accomplishment nowadays. A lot goes on this. Of course, what's the title of the book? I can't remember, but something about how you win a lottery. I can't remember. It was a lady who wrote the something. Single word. It was all about this. Yeah, you may not get whatever you want, but you can accomplish it. That's what it's all about. That mindful rather than mindful. Most of us, our mind is full. You know why? Do you know why? Why our mind is full? If you keep quiet now, don't stop listening to me, and you pay attention to your mind, you find a lot of things are going on in your mind, right? When you try to meditate, when you try to be mindful, you suddenly realize, focus on something, on your breathing or your pulse or whatever, you find a lot of things interrupting, isn't it? You know what that is that called? So sometimes the square can talk a little dominant, more. There's a part of your brain, there are parts in your brain which is very dominant. If you don't have any purposeful activity, there's a lot of things in the background. The dominant mode network activity in your brain which always come in that demand your attention. It can be somebody you remember something, So there's a dominant fault. You can't be mindful because the dominant fault network is so prominent. But that prevents you from the many things. Oh, I got to do this. I got to buy a present for so and so. I got to get something for my spouse or my whatever. A lot. When you start to focus on something, recently I read about a monk. I went to complain to his master. I don't like this place. I can't meditate. So and so is always quarreling. So and so is always gossiping. And they disturb me. I can't focus. I want to go a quiet place. Before you go, take this spoon, put a drop of water. I want you to carry the water so that the spoon, so that no water spill out. So he went about for 1 month carrying the spoon with the water. Very conscious of effect. So after 1 month he come back, master. So how was carrying? I succeeded. I didn't drop the water. Good, well done. So how were you able to do that? Oh, I just focus on this. So how about all the gossips and all the quarrels and all that? I didn't listen to them because when you are focused, all the distractions. It's called TPN. I forgot what it stands for. Total something network. When you focus your mind on something, everything. When you're young and you fall in love for the first time, you hear nothing and you see nothing. All you see is that one person you are in love with, right? That's what it is. So if your mind is always troubled by things, that's what. And meditation calms all the nonsense and allows you to achieve. Okay, so TeraHertz can be used for any inflammation, can be used for pain, blockages, skin can be used. Very effective for all this. Okay, and that's the effect of TeraHertz on your body. It's a very positive effect.
Under skin condition.
All skin conditions. Pregnancy, we don't do acute and qualifying. COVID, chest infection works. Congenital, we don't do object implants is not the official company teaching, but object implants can.
What do you mean implant?
So if you have a stent, can
But
you
you
do
go
that?
on the right, on the other side without it.
What do you think? Cannot, isn't it?
Yeah, because they say that anything
That's what the company's policy is. But yours truly says can.
you say can?
I say
Oh,
can.
you say can.
Because all the experts say can. All the experts say can. The company say can because they want to protect themselves. In case anything happens, that's our company policy. But I'm saying you can. I'm saying even if you implants, you can. All the experts tell you we use titanium implant for one reason and one reason only. Because so many people will go for laser, so many people will go for whatever. If we use metal, iron, cannot. Titanium is the same. That's why you use titanium, because these are living things, right? You put a titanium thing then and suddenly you need to go for laser because your dermatologist tell you need a laser thing. You can say I want. Oh, safe. Because it's no. You see, that's the difference between experts and marketers. I discovered that I used to be with one, and then when he asked me for that, I explained this. We marketers don't talk like that. Marketers are there. You buy, park your money. And marketers are there. Make sure that they are protected all the time. I'm here to tell you, to help you all to have the best possible help. And open wounds and fractures can. In fact, there are a lot of papers that tell you TeraHertz, if open wound, works very good.
Technically, it should.
Huh?
Technically, it should work. Technically, I mean.
Not
these-
technically, it actually
it
works.
Like, yeah.
They have done research study where they have randomized and no, without TeraHertz scan, with scan. A lot of papers now. When I come across once again, this one I discover when people ask questions, can I or not? So let's go online, see what the experts, my colleagues out there in the wide world, have they done anything? And they say, they make it very clear. We use titanium because titanium is safe. So, but don't claim against the company. Company will say, yes, company.
Or the company,
Like not saying.
like confused on your caption at the same time.
Yes, and I'm telling you the science that it can be used. So that's the end of our lecture.